accessing mental health help can be a struggle here in Central Queensland. Up to a year wait to see a psychiatrist in some cases. So the Queensland Alliance for Mental Health, they've put forward a possible solution to address this. It's called the Peer Work Scholarship. Here to tell you more about it is the Director of Operations, Jesson. Good morning.
Good morning.
Just how concerning is the backlog of people needing mental health help in Central Queensland?
Incredibly concerning. So Queensland's currently facing escalating rates of mental health challenges. Our rates of mental health emergency department presentations are actually well above the national average, and self-harm hospitalisations are almost 60% higher than national rates. So it's a really big issue for us at the moment.
Goodness. Tell us about this program.
So peer work is vital, and it's a rapidly growing part of the mental health workforce. Peer workers are able to draw on their own lived experience of mental health challenges to provide a unique understanding and connection and support to others that are going through mental health challenges. Evidence has shown that peer workers can actually reduce hospital admissions, improve people's feeling of being socially included, can reduce the stigma of mental health concerns, and increase hope for the people that they're supporting.
Okay.
To actually address that, what we are doing is working with funding from the federal government to fund some peer work scholarships. So what we're doing is we're giving people with lived experience an opportunity to engage with this nationally recognised qualification. It's the key qualification that's needed for these peer worker roles.
All right. So how does it work? Because if somebody's listening right now and they're having a hard time getting in to see a psychologist, a psychiatrist, which I've heard is an issue here in Central Queensland for sure. How does that peer worker work with individuals then?
Yeah, so they're usually linked in with either community-based organisations, which are our members at the Alliance. Sometimes they're linked in with clinical programs and hospitals. And peer workers tend to be community-based, so they do a lot of outreach work, and they will go and meet the person where they're at in community to help them to feel better connected to their community and kind of help themselves to live well.
Okay. So how does the training work? When somebody's listening to this, they think, well, I've had some experience. How do I get onto this scholarship? But I guess the criteria.
Yeah, super easy. So criteria-wise is that they need to be an adult. They need to be an Australian or New Zealand citizen or hold a permanent residence visa. They need to have a lived experience of mental health challenges as either someone that's had the challenges themselves or even someone who has supported a loved one through mental health challenges. And they need to be able to meet the study requirements. What they then need to do is just go on our website at www.qamh.org.au/scholarships and watch an information session and submit an online application. If they're successful, the scholarship actually covers up to $4,000 for course fees, which we've worked with registered training organisations to make sure that amount will cover the whole course fees. They'll also get $1,000 for any associated costs like travel and study materials, and they'll receive some mentoring support through our partners at Brookred. So it's a super accessible opportunity for anyone with lived experience who wants to use that experience to help others.
How successful has the program been to date, and how many people are you hoping to get on the register?
So currently we have awarded peer work scholarships to over 100 eligible Queenslanders, and we're now seeking 60 more applicants before the current round closes on July 15th. So there's a really big push at the moment, and we need to get these scholarships out.
Jesson is on the line from the Queensland Alliance for Mental Health. It's put forward this program. It's called the Peer Work Scholarship. You were saying that Queensland has those higher numbers than other places. Is this just, what do you attribute that to? Is it just that we can't access the help that we need, or?
Yeah, a range of things. Queensland is a really diverse state, so we have, high density areas, but we're really quite diverse. So while we may have some services in cities, it's much harder for organisations, to get the workforce that they need out in more rural, remote and regional areas. And the mental health challenges are really just being driven by factors like the rising cost of living and housing pressures. And we still have some lingering impacts of COVID too that we're seeing.
It's amazing. So again, can you give us those details of how people can get involved?
Yeah, just go to our website, www.qamh.org.au/scholarships. There's an information session there for you to watch, and you can easily submit your application online.
All right. Appreciate that this morning. Thank you.
Thank you for having me.